I'm Katie again, and I'm going to present to you our MGH Leukodystrophy clinic. Dr. Eichler wished he could be here. We just, as I said, we just opened up in person again, so we are seeing patients in the other room. Okay. So here's a summary of our team. And so most of these people have been here for quite some time. I realized I am missing a picture of our genetic counselor. Many of you know Dr. Eichler and then also Dr. Wishart, who come to these Hunter Hope meetings quite frequently. But we're fortunate to have endocrine and many other subspecialties. And one of our most exciting news for this year is that we have our first dedicated child neurology fellow who will be doing a 1 to 2 year fellowship with us, and just started at the beginning of this month and is super exciting for us. So to give you a sense of the type of patients we see, we do still see about half of the patients we see, a little more, are ALD. But over the last few years, we have seen more different types of leukodystrophies. So I listed kind of this bar graph for you here. Still unknown leukodystrophies is a pretty significant group. And so right now we're still figuring this out. We definitely are going to continue to be having a once a week full day clinic, and we're kind of figuring out if we're going to also have an additional half day clinic for virtual appointments. Where during COVID, our schedules have changed a little bit, and we're just trying to make sure we can still accommodate some remote appointments when possible, but continuing obviously with the in-person. And so during a normal in-person clinic day, we have our physiatrist, Dr. Wishart, neurology, nursing, which is myself, and then genetic counselor, all available in the physical clinic. And the rest of the specialties can be scheduled within usually a 2 to 3 day period. So some things like neuropsychological testing, we like to have done on its own day to make sure people are nice and fresh. And then this is just a picture of what our multidisciplinary clinic has looked like over the last, I guess, over a year now. So we are still going to be continuing some telemedicine, although we're moving to obviously more in person. In addition to our regular clinic, we have a leuko board every morning, and so, or every morning before clinic, so every Wednesday morning. And at that meeting, we review MRIs from our own clinic for that week, but we also review a number of MRIs that are sent to us from outside of our clinic. And so this is just a picture of some of the different parts throughout the world that we've been able to collaborate with local providers to review MRIs. So we can't review an MRI if a family sends it directly to us, but we can review it and give information to a provider. So if the child or adult's neurologist or even primary care sends us the MRI, we can share information and advice to another provider. And so that's how this happens. This is just a moment about our kind of dedication to educating the future. And so as I said, we have Mandy, who's our first fellow. We also have a dedicated endocrine fellow, which started, I believe, last year, which has been exciting. Last year, right before COVID, unfortunately, halted it, we had our first full-time NP placement. So she was doing one semester with us, with coming to clinic 1 full day a week. And then obviously we have residents and everything like that, as I'm sure many of the centers have. We're able to transplant pediatric and adult patients. And I just listed for you here some of the diseases that we've transplanted. We're seeing more and more CSF1R. And so we've been picking up quite a bit on that diagnosis, which is an adult autosomal dominant leukodystrophy. And then I wanted to just briefly go over some of the research programs. So as many of you may know, we were the first site to do gene therapy in the United States for ALD. We've now done gene therapy for approximately 27 boys with ALD, and our hope is that that trial will be being submitted to the FDA this year. We also started a gene trial in collaboration with Boston Medical Center in January of this year, which is a gene therapy for GM2, which would include Tay-Sachs and Sandoff disease. And then we're one of several sites that have recently opened for the Alexander's trial. And then we have several other programs that we're hoping will be starting in the next year or so. And so this just gives you an idea of the pipeline of some of these diseases. This is just a word about that GM2 trial. This is all available on clinical trials if people had questions. Oops, I'm missing a slide. Sorry, I meant to have a slide right here about our CTX research that Dr. Wishart is doing, and that's thanks to some collaboration with Hunter's Hope. And so we've been seeing more and more CTX patients, and I'll try to see if I can find that slide. I apologize. Oh, well, there it is. I guess I just ordered them differently. So this is Dr. Wishart's research in our study, or in our center rather. And then we've been working with several of our adult colleagues. So we've had, for the last several years, quite a nice collaboration with our movement disorder clinic. We're also very interested in working on ocular testing. And so specifically for visual testing that I think I have a video for you here. So this is just talking about, and many of you have probably seen this, this has been published. This is the data on movement disorders in women with ALD. This is a picture of what I think sounds like the coolest trial to be enrolled in, where you get strapped in and it's a balance board. And so they're trying to work, and this is in collaboration with GLIA, to be able to see differences in gait more quickly. And then there's some visual tracking. And this is an upcoming one, but we also have a tracking for ALD, and we're expanding it to some other leukodystrophies, which can try to get at more advanced visual tracking and visual processing. All right, and that's all I have. Thank you.